Hi everybody, my name is Hannah.
My name's Katie.
And today we're going to be talking about the incarcerated population or culture. So for the purposes of this video, the incarcerated population are those currently within the system that are in prisons, jails, things like that, and those who are out either in probation or just living life. So the incarceration rate for the United States has increased dramatically. And there are more higher imprisonment risks that are impacting especially minorities and those in lower SES communities or those who are SES disadvantaged. So prison rates for young black males has reached over 6 times that of their counterpart white males, and for Hispanic young males, it's 2.5 times that over white males. So they're especially targeted and profiled according to these rates. So with this, there's an increase in minority and disadvantaged communities and increased racial stratification. So the communities that already existed that had lower SES or different racial profiles, not very mixed communities, it just increased more as this incarceration rate and the different policies in the court systems changed. So just a little bit more background information. So these are Indiana statistics. So Indiana, according to prisonpolicy.org, has incarceration rates that stand out internationally. So we have 723 inmates per 100,000 people, which is a lot. In 2002, per 100,000 people, there were 2,814 black, 542 white, 781 Hispanic, and 881 American Indian that were incarcerated within Indiana. So both jail and prison incarceration rates have increased in the past 40 years. There was no percentage on how much they increased. It just showed that they were increasing. There are currently right now 47,000 that are locked up in various kinds of facilities, with 1,600 of those being youth, so 18 and below. So the percentage of white incarceration has decreased to about 60%. So they were around 84%, and it has decreased to 60%, whereas the blacks incarceration rate has risen from, I believe, 9% to 34% within Indiana. So right now there are 162,000 Indiana residents behind bars or under criminal justice supervision. So I know I said earlier 47,000 are locked up, but that's with just overall. There are currently 162,000 locked up and under supervision.
So I'm going to talk about best practices at my internship in Hamilton Center and Vermilion County is what I'm going to be referencing because they have Recovery Works. So Recovery Works is a program that was given to Hamilton Center when they applied for a grant for a reentry program with inmates into kind of case management and therapy. It was designed to provide support services to those without insurance coverage. So it has to be the last option payee. You can't have any sort of private insurance or anything like that. And they have to be involved in the criminal justice system. You also have to be, you have to have a felony. You have to be within 90 days of leaving the prison. So there's a lot of qualifications. It's dedicated to increasing the availability of specialized mental health, treatment, and recovery services in the community for those who may otherwise face incarceration. So it helps people before and after. It's intended to supplement community supervision strategies to decrease recidivism. Recovery Works focuses on pre-incarceration diversion services and post-incarceration reentry services. And it's not only hopes to divert low-level offenders from incarceration to community services, but to reduce recidivism by 20% as well. Promoting recovery through community support and treatment intervention is critical because it reduces the number of persons with mental health and addiction disorders in the criminal justice system. So just today with a case manager, which I can talk about a little bit later, I went in and we met with an inmate currently at the jail in Vermilion County, and we talked about reentry, and we also utilize motivational interviewing. So motivational interviewing, as the name suggests, is a technique about motivating a client to change a destructive behavior. This is often used for addiction, as lack of motivation to quit can be one of the greatest barriers for individuals. So even though maybe they quit while they were incarcerated, it's using motivational interviewing to ensure that they continue to keep up these good habits. In spite of health issues, financial support, and legal consequences, sometimes people with addiction still don't really feel that motivation that they need. So motivational interviewing is to help promote that kind of motivation from within. It's the thought of motivational interviewing is that all individuals dealing with addiction are partially aware of the negative consequences of drug abuse and addiction. Every single person in the group is at a different stage of readiness, and so it kind of meets you where you are. So we also utilized a curriculum, and it's called the Reentry Curriculum Merging Two Worlds. The curriculum outlines steps to take before release as well as steps to take after release. The information included in this curriculum will assist inmates in writing resumes, developing life skills, assessing services such as transportation, planning a budget, obtaining employment, furthering education, employment strategies, interviewing techniques, parenting skills, healthcare services, and many other resources. So now I want to talk about my personal experience. So I started to talk about just today going into the jail with Recovery Works. And I've seen this client twice with the case manager. This client has been in and out of the prison system for the past 5 years. He told me in a previous assessment that he had, in the past 3 years, had spent 11 out of 12 months each year in jail or prison at various times. He also kind of bragged about knowing the way everything worked. He knew all of the officers. He kind of knew the system inside and out. And he states that the reason he ends up having to go back to jail or prison is because he's lonely when he gets home. So he calls his old friends eventually, and they bring over substances, and then he ends up using again. Another experience I've had is at Summerfield Healthcare Center working with Huntington's disease. We would get referrals from jails all the time for individuals. And I noticed that nurses and CNAs and just general staff members would treat residents differently depending on where the referral was from, as opposed to like a hospital or a home. If the referral was from prison, people would already kind of have their own assumptions and beliefs about the person coming in. And I also noticed through that, which is part of the Recovery Works technique, is that prisons are really not equipped to handle mental illness, and mental health care is neglected in a lot of prison systems.
So during my time at my job at Harsha, I've been able to have hands-on experience with those that are currently incarcerated and those who have had a history of incarceration. So I've seen where we've gotten patients straight from their prisons. They went to the hospital because they were on suicide watch, and then they bring them to us, and they bring them in their orange jumpsuit, and they're shackled, hands and feet, and the sheriff's all loaded up. We'll walk them in, uncuff them, they'll take their jumpsuits, we'll give them clothes. And during that time there, they're only there a couple of days, but during their time there, we have a set list of guidelines depending on which jail or prison they come from that we have to follow. So one thing is that they don't want them to have pop, whereas all the other patients, they can have pop whenever they want it, and those that come straight from the system cannot, because they don't want it to be seen as a vacation time. They don't want them to go back to the jails or prisons and be like, oh, well, it was a vacation, it was a 3-day vacation, I could do whatever I want. They don't want that. And the same with those that are within the system. So we get a lot, especially since we're a local behavioral hospital, that are frequent flyers of the local jail, so they're in and out, in and out, in and out, or those that have been. So we had one male come in, he had just got out from 20 years of being in the prison. So he had made a plan as soon as he got out to how to get back. So he was there, and he was telling us about how he was going to go back to prison because he didn't know anything else, which is sad. So I think the importance of this presentation is understanding the culture that is within this population, how they learn to conform to these rules, and they aren't shown the outside world, and the misconceptions and stereotypes that they face in mental health facilities and anywhere. As soon as somebody hears you have a record, people treat you differently. So I think understanding this culture will be able to help provide them services. Thank you.